Hello, everyone. I'm Ben Rouffy-Ly from the Health Systems Governance Collaborative. And today it is my privilege to have this conversation with Dr. Ngoy Nsenga, who is leading the WHO response to COVID for the African region. So welcome, Dr. Nsenga.
Thank you very much, Ben, and thank you for having me.
So it's a great pleasure. So you've spent a lot of your life trying to improve health security with a bit of a systems lens. And you're someone who's very interested in the intersection between those two fields. So from your perspective, how does that work? How are health systems a core part of the health security agenda?
Thank you very much again, Ben. Yes, indeed, I've spent more than 25 years in health security arena. Learning from my experience, it seems as yes, countries, they've done some development. I mean, they've moved forward in terms of health security, but still there is a lot to do. And my own perspective is most of the time when we talk about health security and health emergencies, we most of the time look at in the health from the health perspective alone, and sometimes even from the health security alone, from the health emergency management alone, which I think does not fit the reality of emergencies and health security, because health, by the way, depend on so many factors, even outside of the health system. The same way, health emergencies and health security depend on so many other factors, even outside of the health sector itself. So I think this is where we are still struggling with countries, is how do we frame the health security?
Thanks. And I'm of the view of the health systems being more than the building blocks and all the other parts of it, say One Health, animal health, planetary health, all these are very related. And I think you would agree that that's also very relevant to health security. You have to be protected from all kinds of risks and possible disasters. So one of the aspects of that is to include, from the health systems perspective, social determinants. And we've seen in the pandemic, for example, that social determinants have been critical. We've seen that in Western countries, minorities and the poorest part of the population have been most affected. So maybe I'd like to ask you, how do you think, how are social determinants taken into account in the health security strategies, and what could we change to address them more effectively?
You are touching a very interesting subject, which I always like talking about. I have this theory, which I started, which I call how do you call it, the social determinant of outbreak. At the beginning, people used to, it used to make people laugh. But I think with the COVID now, it has become clear that social determinant of outbreaks exist indeed. So what did I mean? How did I come up with this theory or concept of social determinant of outbreak? Just by looking at my region, the Afro region. As you may be aware, we record about 100 emergency public health events per year, every year. And of those, 80% at least, they are made of infectious diseases outbreak. So then when I look a little bit deeper in some of the infectious diseases, including cholera, I was kind of surprised, because usually cholera is give people water and sanitation. This is how you combat cholera. But then when I started looking at the data, I noticed that there are countries, we have basically around 23 countries which are cholera is endemic in the Afro region. But when you look in those countries, you find that there are countries, even though they have, in terms of access to clean water and access to sanitation, they are above the African average, but still they are endemic to cholera. Then you have other countries that are below the African average, but still they are not endemic to cholera. So it just prompted for me some questions. So then when you look here deep in the data, of course, there might be within countries' disparities. But at the end of the day, if you look at it at population level, not at individual level, you'll notice that clean water and improved sanitation is not all that matter. Other factors, social factors, they are as well important. That's why I actually even went to conduct a study and see how these social factors were related to cholera particular. A factor that you might not think, like literacy, like women gender inequality, like income inequalities. Then when I conducted that study, I noticed that by themselves taking only one factor, there was no association with the incidence of cholera. But if you put the combination of those factors and their interaction, yes, there was association with cholera, with the incidence of cholera. So just to say that these factors at population level, they are very, very critical. And again, as you mentioned, in COVID, it has shown that people are affected disproportionately based on their social status and sometimes their social, several social. And we have, again, the example of what we are discussing. If you look at European countries, the rich countries, where we're expecting for these countries to do much better in terms of combating the COVID, compared to African countries, we're expecting catastrophe in Africa for so many reasons. Not maybe necessarily alone public health reasons, but for so many reasons, it becomes like the other way around. We see European countries struggling, literally, while African countries are affected, but to lesser extent. So just to mention that there are other factors beyond the obvious one, beyond the public health ones, that impact on the dynamic of an outbreak in a country.
Yes, thank you. That's very interesting. And that actually set me up perfectly for the next question I had. So as you mentioned, a lot of experts at the very outset of the pandemic were predicting a terrible toll on the African continent, mainly because they projected that health systems in Africa were not robust enough to withstand a pandemic. And then we see that it's not what happens. So there are a lot of possible explanations there. We've heard that maybe it's because the pyramid of age, the way the population is not the same. There are more younger people in Africa. We've heard also that it may be the temperature, whereas at the beginning we didn't think that there would be a seasonality of the virus, and there seems to be one. So maybe that's one factor. Others have also said that maybe African countries are better equipped to deal with this kind of pandemic because, as you said, you have a lot of infectious disease every year. So maybe the health systems can't do everything that health systems in the North can do. But one thing it can do is try to control epidemics. So what's your take on that? Why do you think that the African region has been doing so much better compared to COVID than the European country?
Yeah, again, I take it from my socio-ecological approach to outbreak and diseases. Is a combination of several factors. Of course, first of all, we have to distinguish the factor that impact the transmission in the community, and the factor that impact the severity. So factors like the age structure, of course, they will impact more the severity of disease than the transmission of the disease. So it means we might have the same number of cases in terms of transmission and amplification in the community, but people will die less because these are younger ones. They don't have comorbidities. They do more mild form of the disease. So those are factors that impact the severity. Now, in terms of transmission, there shouldn't be, in theory, there shouldn't be difference of people living in other regions than living in Africa who are displaying the same behavior of transmissibility of the virus. There shouldn't be. But now, when we look again at community level, at population level, beyond not only the obvious one, what can we put as hypothesis? So of course, there is human interventions, all the non-public health measures that the countries have put, I always say, they have had some impact because in Africa, most of the countries, they took this decision or they put these measures in place, some of them before even having a single case, because the timing of the measure is also important, not only to take the right measure, but the right measure at the right time. So these might have some impact, but that's not all. In addition, we think there are all other social factors, socio-economic factors that may have played the impact of the dynamic of the pandemic in our region. For instance, the first cases that we had in Africa were mostly localized in urban area, in cities, in towns. And when you look in town, in most cities, in capitals, it was not even the whole cities. It started in well-to-do people areas, like in very upper end residential area. And most of the time, these are the people who do not take public transport. You know, our public transport in Africa is very crowded, but these people, because they are in upper end, they usually don't take public transport. They usually don't mingle very that often with people living in slum. So it kind of helped a little bit because of that social, again, gradient of the cities, how they are. It kind of helped to contain a little bit the outbreak for a certain period of time in those areas. Then there is another factor, is the mobility. And that's why we are taking some of the factors to, again, do the study and find out how much, to what extent these factors play the role. The mobility between cities and the rural area. Again, there are countries where they took measures, strict measures, they locked down all the cities and people could not get out. But they're also natural, if I can put it that way, whereby just because of the infrastructure, people could not go easily from cities to provinces or even rural area, again, putting a barrier between people living in cities and people living in the rural area, and delaying the transmission of disease in more rural area. So these factors may be the road density, the public health, the public transport density. They also played a role, negative this time, but a positive, negative, was in delaying the transmission of a disease and the amplification of the disease in the community to a certain extent. So these, we think, there are also social factors that played a role in containing the disease in Africa. But now, as I'm talking now, we are seeing the other way around, that rural areas now are being affected. That's why we see an increase in number of cases in some countries. And we saw when South Africa, for instance, in South Africa, when the slum were affected, the number of cases rocketed. I mean, it went so high, and South Africa was one of our most affected countries. Again, just to come to, there are so many socio-economic factors that impact and play the role on how the pandemic comes out in a country and within a country, and the difference between countries and the difference between region, and even the difference between geographic entity within a country.
Yeah, thank you. Related to that point, we also thought we were saying that public health measures were very important. The timing of those measures were important also. And we've seen in some countries that they have taken very strict measures very early on, and those countries were a bit success stories because they fared very well during the first wave. But the downside of having such a policy is the acceptability. We've seen that those countries who had such radical policies at first, now they have a much harder time having those policies again to face the second wave. And I think that also links to the social determinants in the sense that poorest part of the population are more affected by the outbreak, but they're also disproportionately affected by public health measure like lockdown. If you live in a crowded area, lockdown is much harder. If you're in the informal sector, lockdown is much harder. You have to choose, if you have to choose between eating and protecting yourself from the virus, you're going to choose to eat, of course. So from a health security strategy, what can you do to mitigate the impact both of the epidemic, but also of the public health measures to those most affected, most vulnerable populations?
Right, you're absolutely right. You know, not long time ago than this morning and last night, I was watching CNN and I could see in developed countries, developed as the US, where they were reporting queues in front of a food bank because people, they really they can't make it, they end meet, they have to go to get food from the food bank. So, and we have seen also in Africa that economically, even though it can't be measured because our people, especially the low income people living, they live on day-to-day basis, and their sort of income is non, how do they call it, non-formal. So measuring is really, but people in countries where they have instructed very stringent measures, people have been highly affected by this measure, not by the COVID itself, to the point where people started saying, we better die with COVID than die with hunger, because at the end of the day, we're going to die. So they had to move on. And people, yes, they've been seriously economically impacted by the COVID in most of our countries. And even the country themselves, you have heard, I think some of the countries, they are on the brink of defaulting because of the impact of COVID. So now that's why we are suggesting to countries, and again, to countries, based on my theories, we should not, maybe in the first phase it was necessary, but at this point, we should not impose blanket measures to everyone. Again, why? Because the COVID does not affect, even within a country, does not affect everyone the same way. And it does not affect every individual the same way. There are people who are at high risk, again, of having a severe disease. Those people, we should protect them. But there are younger ones who, most of the time, they do mild disease. I think we should protect them maybe in the most kind of focused way. The same, we have areas that are heavily impacted. We have regions and cities that are heavily impacted. Even within a city, we have areas that are heavily impacted. So the measure should be calibrated and differentiated based on the risk. That's what we call risk-based approach. Who is the most affected? Where is the most affected? Then we calibrate our interventions based on those risks so that we keep at the same time the level of livelihood, not only life, but livelihood for people, but also protecting at the same time and preventing further expansion, transmission in the community. I think this is not only for COVID, it's a lesson learned for all the other diseases that we're talking. In order to really fight in effective manner diseases, we have to go into what are the risk factors, not only health, again, going beyond health. What are the risk factors? What are the vulnerability factors? What makes people exposed? I'll tell you an example. Again, I'm coming to my cholera, which is an example I've studied a lot in our region. You know, when we say we provide people water, again, that's fine, clean water. We provide sanitation, that's fine. But I have a picture, I had a picture which was took by one of my colleagues in Uganda, which was very telling. This is a mother, she has been provided with clean water, sanitation is great, but then she had to wash her dishes with the clean water, of course. But when she was washing the dishes, because she didn't have soap, what did she do? She used the sand. She used the dust to remove the grass from her dishes. So what is she doing? You gave her clean water, true, she has a sanitation, but more likely she's going to infect or her dishes by using the sand, using the dust. So you see, is a factor. Where is it coming from? Is it not coming from because she doesn't know? No, it's coming from because she has to use something to clean the dishes, and she has nothing. She has no soap. So she has to use something. These are kind of type of vulnerabilities which sometimes we don't think that they are related to cholera, and at the end of the day is why cholera continue to persist in our communities. So this is again a lesson learned, not only for COVID, is we should also look at the other vulnerabilities, social vulnerability, environmental vulnerability, even our health system vulnerability. Addressing those will help us a lot in addressing health security in our countries.
Yeah, thank you. Yes, I think one big lesson learned from COVID is that is the magnitude of the interconnectedness of health and all the other social determinants and vulnerabilities. So my last question to you before we close that discussion would be, if you had to reflect a bit and propose 2 or 3 main pathways or actions that could be taken to try to address this thing in a comprehensive manner, what in the next 5 or 10 years, what should be the work of the public health specialists to better address those social determinants and maybe capitalize on the political capital that we have for health right now because of COVID?
No, true. I've discussed some of these as a way forward with some of colleagues. For instance, I say the role of public health event should not be only addressing the public health event. It should be also detecting the health risks or the risk factors and providing them to other factors is what I call how do we operationalize health in all policies. Because for them to address the health issues in other policies, we need to give them what is bringing the issue, what is the root issues, so that we address. For instance, I was telling my colleague for the World Bank, I said, look, you are doing a great job in terms of development, funding development. But the development, if I say let us build this or cholera, you say, no, this is health. But then my role is also to tell you, look, by providing, like I was saying, enough income to this lady so that she can afford the soap, you are actually addressing my problem of cholera. So is where we are is to also mention or indicate and detect first the risk factors and provide it to other stakeholders and especially development stakeholders. That's how we can address issues in the health security, right? And in the health security, in the health emergency area as well.
Thank you very much, Dr. Ngoy. It was a great pleasure talking to you today, and good luck with the continued effort to control the COVID pandemic in Africa.
Thank you so much, Ben. Thank you for giving me the opportunity to have such a discussion with you. Thank you so much.
Thank you. Bye-bye.
Okay, bye. I appreciate it.